Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. Sitting in for Pinky Webb, I'm Ruth Cabal. Today on the program, President Rodrigo Duterte is set to decide on the new quarantine status for Metro Manila and other regions. Local leaders and experts say another month of general community quarantine will keep the momentum going. All is set for the training bubble for the Philippine Basketball Association in Clark. We get to know the safety measures in place amid the COVID-19 threat. And the battle for House speakership heats up. Both majority and minority blocs back the leadership of House Speaker Alan Peter Cayetano. Testing czar and COVID-19 Task Force Deputy Chief Implementer Vince Dizon and House Minority Leader Benny Abante. Join us live. President Rodrigo Duterte is expected to announce his decision on whether Metro Manila should stay under general community quarantine for another month or shift to a more relaxed form of quarantine or the MGCQ. Trade Secretary Ramon Lopez says the National Capital Region is ready to shift to MGCQ as long as health protocols are in place and observed. Experts, on the other hand, said that despite the downward trend, Metro Manila should remain under GCQ for now. Let's go straight to the source of this story. Testing czar and COVID-19 Task Force Deputy Chief Implementer, Secretary Vince Dizon. Good morning, sir.
Morning, Ruth. Good morning.
Secretary, we've breached the 300,000 cases in terms of, COVID-19 positive, but we're seeing a downward trend. The last 6 days were less than 3,000 cases. Also, we are the top in terms of testing in Southeast Asia. So how would you assess the situation now?
Well, first of all, we're still grappling with the very, very difficult situation we're in, as is the rest of the world. Like what we always say, COVID-19 is here. It will continue to be here until there is a vaccine that can be widely distributed to the majority of the population. So we still have to deal with it on a daily basis. We have to battle this pandemic every day. And we cannot let our guard down because it can hit us again at any time. We're optimistic in the sense that, number one, we have been able to arrest the spikes that we saw in the latter part of July and most of August. Bumagal na ang pagtaas. And as you said, and as the experts have said, there is a downward trend in the number of new cases every day. We peaked at a high of, I think, more than 7,000 cases, new cases in a day, sometime in August, early August. Now we're down to the 2,000 level. In the National Capital Region and the Greater Metro Manila area, we had a high of about 4,000 in a day. Now we're about at the 1,000 level. And in fact, I think the past couple of days, it registered below 1,000. So this is all positive news. But like I said, like what we always say, there is no room to be complacent. And we just have to keep on fighting this battle every day. So we have taken into consideration the recommendations of the experts as well as the Metro Manila mayors to retain GCQ and NCR. But of course, this is a decision that the president will make maybe by tonight or today or tomorrow. And we will see what the decision is.
Mm-hmm. But as testing czar and based on your observations also, may downtrend nga. What do you think? Is Metro Manila ready to shift to MGCQ?
Well, there are parameters to make that decision, Ruth. The numbers have been improving, but I think our capacity utilization or our available capacity is still not at the level which will bring us down to MGCQ. But like I said, it's a decision that the president will make, and I think we should wait for that decision either tonight or tomorrow.
Secretary, sorry, you were saying it's not the level to bring it down to GCQ in terms of what considerations again?
Care capacity utilization. So we're not at that level of MGCQ yet, no, for NCR, unlike other areas which are already at that level. However, there has been a substantial decrease in utilization of our hospital beds and our critical care beds. No, I think we're down to the 50% mark.
Yes,
but while past couple of weeks we were at 80%. So there has been a substantial decrease in utilization, but we're not at MGCQ level yet.
Yun nga, that's what I was going to ask you kasi last week lang the health department was also saying that they observed an increase in the critical cases ng ng COVID-19. But who kaya ganon? They were saying dahil yung sa marami yung nagho-home quarantine, do you consider that another parang setback?
Yes. Well, we all, after 6 months of battling this, we do understand that the most vulnerable people in our population are the most prone to become critical patients. So we're talking about the elderly, we're talking about those that have underlying conditions. We feel in the National Task Force that home quarantine is a major factor in this, because even if the positive patient is asymptomatic, but there are members of the household that are vulnerable, that are elderly, that have diabetes, that have heart disease, then they can be infected by the asymptomatic patient. And that is why we're very strongly advocating a very stringent rule that will allow us to take the positive patients outside of the homes and put them in facilities such as quarantine hotels and also quarantine facilities. So we've seen home quarantine as a major challenge, and therefore we want to address that. And I think the IATF has will already come out with the detailed guidelines on this very soon.
Secretary, let's talk about testing. Right now, where are we in terms of testing? Also, may iba-iba kasing bagong testing technology na lumalabas ngayon,
Yes.
no? So, can you tell us more about this?
Alam mo, we've gone a long way in terms of being able to test a huge number of people in our population, especially in areas that are most prone to having outbreaks of COVID-19. I think we've already breached the 3.5 million test mark. We're at, I think, about 3.6 plus million already. This is a far cry from the very, very poor testing output that we had in the beginning, especially in March, April, and May. But we still need to do much, much better. And we need to test more. And more important than testing more is being able to test faster. Yun ang pinaka-importante ngayon. And fortunately, there are new technologies, like you said, that are now available across the world that allow testing to be faster and more efficient. We're talking about the antigen tests that have recently come out. We're talking about the new saliva and breath tests that have been coming out of various countries throughout the world. And we have to be ready to adapt to that very quickly. So kailangan mabilis tayong mag-adapt at mabilis nating magamit itong bagong mga technologies na ito. So we're waiting for the Department of Health and our regulators to come out with the guidelines for this. We are already doing pilot testing of antigen tests in Baguio.
In Baguio, yes.
So we're waiting for the results there. But I think we can do this faster. Dapat mas mabilis tayong mag-adapt dito.
Okay, yung ilan po ba ang target natin before the end of the year in terms of testing?
Our target is roughly about 10 million tests by early next year. So that's roughly 10% of the population. However, we want to test more, especially in the epicenters like NCR. That's why in NCR, we're already, I think, at the 15% mark. No? 15% na ng NCR ang na-test natin. Pero kailangan pa rin to dahil evolving itong
Yes.
pandemic na ito. No? Hindi natin alam kung ano mangyayari sa mga susunod na buwan. So the critical factor that we need to have is capacity. No? And that's what we've been trying to build up. From one lab in February, we're now up to 135 labs. But if we can use these new tests that actually don't require a laboratory, they are what they call point-of-care tests, like the antigen tests and the breath tests and the saliva tests, then we will greatly expand our capacity to test, because we won't need laboratories anymore.
Yeah.
We could do the tests already at the point of care, or at the point where we can test our people very quickly. And for example, yung antigen test, Ruth, 15 minutes lang lumalabas na yung resulta. No? So napakabilis niyan in terms of our COVID response. No? And I hope we can adapt them and use them as soon as possible.
Very promising itong saliva and breath tests. Where are we on this now? And paano po ba ito? And then paano yung sourcing ng gamit para dito?
Yes, the private sector is taking the lead in looking at the pilots for these tests, and we're very thankful, especially to Project ARC, led by Mr. Joy Concepcion, and to all our other private sector partners. But of course, these need to go through our regulators. They need to go through the Food and Drug Administration. They need to go through the Health Technology Assessment Council, mandated by the Universal Healthcare Act. So we need to go through these, but hopefully we could do it faster, given the needs of our response to the pandemic.
Secretary, ano po ba ang accuracy niyan, and yung presyo naman, if ever mas gugustuhin niya ng tao?
Una sa presyo, halos kalahati siya ng PCR, or mas mura talaga siya, sa
like about
PCR.
How much? Kasi ang PCR natin ngayon, minsan mura
I think anywhere from 1,000 to 2,000 pesos yung antigen, which is roughly half of the cost of a PCR test. So malaking bagay po yun. As to accuracy, syempre ang PCR pa rin ang gold standard. However, hindi na masyado nagkakalayo, as far as we have been told by the experts. Pero syempre kailangan pa rin evaluate to through the pilot studies that are ongoing right now.
Pero if ever, not just for antigen or for itong saliva or breath tests, if ever, yung ngayon pa lang yung PCR, is there a way that we can probably lower yung price nitong testing, or probably impose a price cap? Kasi yung ibang private hospitals talagang ang mahal din, 8,000, 10,000 pesos
Mahal
yung
po.
kanilang testing.
Mahal. Alam mo, ang kinagandahan naman po is na-expand na natin ang testing guidelines, and dahil doon, marami na sa ating mga kababayan ang makakapag-test ng libre through PhilHealth. At lahat naman po tayo ngayon, dahil sa Universal Healthcare Law, ay members ng PhilHealth. Pero tama po kayo, at pinag-aaralan na po ngayon ng ating regulators ang pagka-cap ng testing cost, and testing fees natin for all types of tests, especially PCR, which remains the gold standard of testing. Pero alam nyo, as the technologies evolve and as we adopt these new technologies, natural pong bababa ang cost ng testing. Dahil, alam nyo naman, dati, nung una, halos walang testing na available. Kulang na kulang tayo sa lab. So, yung supply natin of testing napakababa at yung demand napakataas. So, syempre, mataas ang presyo. Pero ngayon, na dumadami na ang supply, marami na tayong laboratorio at marami na rin mga ibang tests na masasabi na rin natin very accurate na din. Bababa kusa yung presyong yan. Pero pinag-aaralan din ngayon ng ating mga regulators ang pag-impose ng cap. At very welcome po yan, lalo na para sa marami nating mga kababayan na hindi naman kayang mag-afford ng isang test na napakamahal.
Okay, and PBA fans, listen up, because teams will start their training bubble in Clark this week. Secretary Vince Dizon tells us more after the break. You're watching The Source on CNN Philippines. Stay tuned. We're watching The Source on CNN Philippines. Our guest today, testing czar and COVID-19 Task Force Deputy Chief Implementer, Secretary Vince Dizon. And sir, you're also President and CEO of BCDA. The PBA bubble will be held in Clark. Can you tell us more about that?
Yes, we're very excited to host the PBA bubble. It's our first sports bubble in the Philippines, in Clark. They will begin actually coming into the bubble today and the next couple of days. We want to assure the public and everybody, especially all the entire PBA family, the players, the coaches, the staff, that we will make sure that this bubble is a very safe bubble, and we will protect the health safety of all the people who will be participating in this bubble. But I think the important thing to talk about the PBA bubble is this is a way for us to show that we can already start going back or going into what we're now starting to call this new normal. And we can start enjoying and benefiting from the things that we used to enjoy.
Mm-hmm.
And obviously, basketball is our national pastime. A lot of our fans have been waiting for the PBA to restart since its suspension in March. And I think this is something that will be very welcome to everybody, and this will bring a sense of not only excitement but hope for everybody.
Mm-hmm.
That slowly we are starting to deal with this pandemic and allow some sense of normalcy to come back to our lives, no?
Mm-hmm.
And kahit na walang spectators, Ruth, no, bawal kasing may manonood.
Online
Everything
lang,
will
ano?
be virtual.
Mm-mm.
And of course, on television and of course online, similar to other bubbles abroad, which we have modeled this bubble from, the NBA, etc. At least makikita na ng mga PBA fans all over the country ang kanilang mga idol na magsisimula ng maglaro ulit.
Secretary, so what's going to happen? So lahat ng players, I think even the media is kasama sa bubble, even for tests, ano? Paano yung mga safety measures dyan? Yeah.
Yes, so there are very stringent protocols, no, for entry into the bubble. Unang-una, magkakaroon ng mandatory pre-entry PCR test. Pagka-test, at ginawa na nila ito last week, yung ating mga PBA players at mga coaches na papasok sa bubble. After nung unang test, kailangan nilang strict home quarantine for 5 days. At katapos ng 5 days, darating na sila sa Clark, pero itetest sila ulit.
Mm-hmm.
No, ipi-PCR test sila ulit, at kailangan nilang mag-isolate sa kanilang mga rooms sa Mimosa, sa hotel, until they get their result. No, kailangan muna nandun sila, hindi sila makakalabas doon, ang pagkain nila dadalhin lang sa kanila. Pag lumabas na negative sila, then pwede na silang magsimula ng kanilang practices and other activities within the bubble.
And
this goes for all the other people who will be part of the bubble, even the media na papasok sa bubble.
When will the game start?
The official games, I think, magsa-start ng second week of October.
Mm-hmm.
Pero magsi-scrimmages muna at magpa-practice muna for about 2 weeks.
Okay. Thank you very much, Secretary Vince Dizon, COVID-19 Task Force Deputy. And we'll be right back. Just keep it here on The Source on CNN Philippines.